Thank you. Thank you, Professor Aziz, for your nice presentation. Dear guests, our next speaker is Dr. Amir Sheikh from London, United Kingdom. He is going to talk about medical cupping therapy, achieving our goal and ensuring our legacy. Welcome, Doctor. You have 15 minutes.
Okay, assalamu alaikum everyone. My name is Dr. Amir Sheikh from the British Cupping Society, and I'd like to thank the organizing committee on behalf of all the members of the British Cupping Society for giving us this privilege to present to you today. My talk is going to be a little bit less technical than the ones you've already heard. It's about how we can secure cupping therapy, professionalize it, so that it continues to benefit the whole of mankind and humanity, and this is what our primary aim is as the British Cupping Society. So, the purpose of this talk is to present you for a case for professionalizing cupping therapy, to present our experiences with professionalization and standardization in the UK, and to plan our legacy for the future. So everybody remembers stories, and every story has a beginning, a middle, and an end, so let's start at the beginning. What did people say in the beginning about cupping therapy in the UK? They said, some of the practitioners amongst us said, why can't anyone do it? Some were saying, it's not safe. Some were saying, we have drugs now, why do we need cupping therapy? Some people said, where's the evidence that it works? And some people said, it's like the chicken shop phenomenon in the UK. We have one on every street, and now we have a hijama clinic next to every chicken shop. Okay. So what happened in the past? Let's talk about the procedure, the practitioner, and the environment, and what went wrong in our experiences in each case. Let's talk about the procedure. We have alternative methods of cupping, fire cupping. We have dry cupping, which can be very aggressive. We have cupping that involves a lot of cups. We have cupping that involves a lot of suction. And we have cupping that involves animal horns and is a danger to animals in general. We have practitioner problems. Practitioners practicing in particular ways, as you can see on the street here. We have problems with practitioners and their personal hygiene. We have problems with practitioners cutting too deep. And we had problems with the environment also, with people practicing in their living rooms, in their community centers, and in the public baths. Okay, so you can see some of the problems that we were faced with when we were starting up in the UK. So, how was the situation? We had people practicing Chinese cupping therapy, Islamic cupping therapy, Arab cupping therapy, spa cupping therapy, and people just making really unrealistic claims about cupping therapy itself. So what did we do about it? Well, we set off to preserve the Sunnah, and we thought that these things were unacceptable. This is what we did. Let's get an idea of the numbers of patients involved that receive cupping therapy in the UK. We asked a cupping equipment supplier about their customers in a 3-month period. They told us that in 3 months they sold about 57,000 cups. This person has a 20% share of the market, so let's translate this to 100%. And let's, for say example, people have 12 cups per procedure or 6 cups per procedure. This gives us a total number per year per the UK population between 90 to 200,000 procedures. Bear in mind there's 2 million Muslims in the UK. This represents about 10% of the population, and they are not the only ones to receive cupping therapy. So you see my problem here? There, with so many procedures, there is a risk of blood-borne disease, skin infections, adverse events, people practicing in a non-healthcare setting, people not adhering to any codes of a professional body, effectively resulting in a negative publicity for the whole of cupping itself. And this is something we want to preserve in the first place. So what did we do? Myself and my colleagues here, we set about giving ourselves goals from the problems that we encountered. First problem that we encountered was that there was a procedure variation. So what did we do? We standardized the cupping procedure itself. And it was not too similar to what Professor not too dissimilar to what he told you with his research just in the previous talk. We said, look, there's an inadequate evidence base, and this is the language that we need to speak to people and give them the evidence base for it, to say that it works. What did we do? We formed international research collaborations with colleagues from all over the world to set up projects in particular diseases we were interested in. We said, okay, the practitioners vary in their experience and they vary in their practice. Let's give them a standard curriculum. Let's give them a workshop so that we know everybody is practicing to the same level. Furthermore, we gave them instructions on how their environment should be when they're practicing cupping therapy itself. So we gave them an operations manual. We said, look, our practitioners have to be accountable to the general public and they have to be answerable. So we set up a system whereby we set up indemnity or insurance and a complaints and disciplinary procedure for our practitioners. We realized that the public had a lot of misinformation about cupping therapy, and of course this was not acceptable to us because again we want to preserve the sunnah and put a positive image of it. So we made various campaigns in the media, on social media and roadshows. God knows how many Facebook pages I'm on, but we got there in the end. This is some of our presence. So we've been cited in the Huffington Post, in international media, on the BBC, on the Independent. This man's actually mentioned us in his novel, which was very nice of him. And we've been mentioned on the BBC as well, and Dr. Sarfraz, who's here with me, has been quoted many times in articles and newspapers regarding the importance of safety of cupping to the public. We are on MSN Health as well. So the reason we are here today, this is our international conference, and we've done a few now, is to raise the profile of cupping therapy on an international platform and to provide support and advice to local and government bodies onto how to effectively roll out cupping programs in their population and ensure that it's delivered in a safe way to members of the public. Now, you realize I've shown you how many problems? About 7 or 8. Each problem takes us about a year to sort out. So 8 years and 7 children between us later, where are we now? We analyzed the standardized procedure that we went through, and we audited it on about 50 patients, and we came up with these side effects. The most common side effects to cupping therapy we found, and this was so we could explain this to our patients on their consent and make members of the public aware. As you can see, the majority of 2/3 of people didn't experience any side effects from the cupping procedure itself. Then came about 20%, 20 to 30% of patients. They suffered what we would regard as pre-syncope, which was transient hypertension, dizziness, and nausea. We didn't experience any skin blistering, and we had 1 episode of vasovagal syncope during our procedure, giving an approximate rate of about 2%. And what effects does our standardized procedure have on the skin healing post-procedure? We analyzed the patients on follow-up 2 to 4 weeks later and found that more than 2/3 of them had normal and full healing on the skin. And you saw some of the evidence of bad healing on the pictures that I showed you. Scars were visible but not hypertrophic in about 12% of cases. we had no episodes of keloid scars, no atrophic scars, and one skin infection. And this was because our patient decided to go for a Turkish hammam after the procedure itself, which we did not advise him to do in the first place. Right. So what about the present? How have we professionalized cupping therapy in the UK? Well, given that we've got a duty of care to the public and ensure public safety and safeguard this procedure, we have become members of the alternative regulatory body for complementary therapies in the UK called the General Regulatory Council for Complementary Therapies. They are composed of a federal regulatory council. Each has a subsidiary which is responsible for each alternative therapy. Cupping therapy is one of them, and we as the British Cupping Society are regulatory members of the GRCCT. What does this mean for us, and what does it mean for the public? It means that the British Cupping Society is an approved national regulator in the UK for cupping therapy. We have a common code of conduct that we ascribe to under the umbrella of the GRCCT. We have standardized practitioner requirements and occupational health clearance requirements. We also will have an open access database for members of the public so that they can look up the names of our approved cupping practitioners, all making practitioners accountable to complaints and disciplinary procedures. What do we plan for the future? So, we have managed to standardize the knowledge in terms of the education we provide to health professionals. We have a continued professional medical education program for our practitioners. We have workplace guidelines. We have and this is the most important thing. Many of you will see that in this conference, it's a prophetic medicine conference. And the theme that I hope that you'll see, that prophetic medicine is a holistic therapy, looking at physical, social, even at the biochemical level, in the talks that you've seen already. We feel that cupping therapy is one part of a holistic therapy, okay? We want to develop this further and integrate it into the mainstream healthcare system so that you can go to your cupping therapist or your doctor and he will recommend cupping therapy as a treatment accepted on the National Health Service. This is already happening in Europe at the moment in countries like Germany and Austria. We've provided the NHS with information leaflets so the patient can be more aware. We've collaborated with all these agencies, including at a governmental level and a professional level. And we've provided a route for healthcare professionals to standardize their training and competency, which leads to them obtaining a provisional license, leading on to a full license for which they are required to renew every year, given that they have a continuous professional development with a revalidation and appraisal every 3 years. So in conclusion, what can I tell you about our experiences and how we think we can secure the legacy of cupping therapy as a sunnah and a medical therapy which is available to the whole of mankind? Because let's face it, that is the aim of prophetic medicine, isn't it? Not just for the Muslim community, but for everyone. How are we going to achieve this in cupping therapy? We have a collective duty to professionalize cupping, and I believe professionalization is preservation. We've seen the benefits of cupping therapy beyond the placebo, and we have proposed a framework for professionalizing this therapy itself, both in the UK, and we believe this model can be replicated internationally. So we are willing to work with anyone who is here today, who shares our goals and objectives to move this therapy forward so that we can all benefit and benefit others around us at every stage possible with this amazing therapy. Thank you.
Thank you, Dr. Amir, for interesting talk about the practice of cupping in UK. Small gift from the society. May I call Dr. Abdulaziz Ismail, please, to join us? We forgot to give it to you. Please. And as well, Dr. Sinol, to prepare for his lecture. Do we have Dr. Sinol Torgotozal?
Thanks. Our next speaker, Professor Sinal Devin, Turgut Özal University from Turkey. Welcome, Professor. You have 15 minutes.
Bismillahirrahmanirrahim. Esselamu aleyküm ve rahmetullahi ve berekatuhu. Allahümme salli ala seyyidina Muhammedin ve ala ali seyyidina Muhammed. Tıbbel gulubu ve devaiha ve afiyetil ebdani ve şifaiha ve nuril ebsari ve diyaiha. Ladies and gentlemen, thank you for your kind invitation of organization committee. Wet cupping, hijama and cardiac rhythm, my topic. Cupping is a traditional complementary treatment used in public medicine and also by clinicians in many countries. Cupping creates a vacuum over certain points of the skin. Two methods of cupping: dry and wet cupping. Cupping is a prophetic medicine application. A glass cup is applied on the skin over an generally acupuncture points, painful area and reflex zone. Dry cupping has an only vacuum application. Wet cupping has also medicinal bleeding. Cupping therapy in both wet and dry forms is still used today in many cultures. Cupping is thought to remove noxious materials from skin microcirculation and interstitial compartment. Dry and wet cupping drains excess fluids and toxins, loosen adhesions, bring blood flow to skin and muscles, and stimulate the peripheral nervous system. Cupping reduces pain and high blood pressure, modulates neurohormones and the immune system. Used to improve subcutaneous blood flow and to stimulate the autonomic nervous system. A symptomatic treatment for a wide range of conditions seen in clinical practice, such as pain, hypertension, and stroke rehabilitation. The stimulation of pain fibers in wet cupping therapy causes release of beta endorphin and adrenocortical hormone into the circulation. These hormones might help to block inflammation in arthritis. Cupping also has beneficial effects on the immune system by releasing of beta endorphin and activation of opioid system. In a recent study by Nigay and Jones, investigated heart rate variability, change in response to transcutaneous electrical nervous stimulation like acupuncture over an echo point similar to wet cupping. Heart rate variability parameters were increased after transcutaneous electrical nervous stimulation. The effects of wet cupping on cardiac arrhythmias and infarct size after the experimental myocardial ischemic reperfusion injury in male rats were studied. Reperfusion injury caused an infarct size of 50%, whereas dry cupping and single and repeated wet cupping reduced infarct size to 28%, 35%, and 22% respectively. The rate of ischemic-induced arrhythmias was corrected by wet cupping. There are complex interactions between the sympathetic and parasympathetic nervous system inputs to the heart. The concept of sympatovagal balance reflects the autonomic state resulting from the sympathetic and parasympathetic influences. Heart rate variability parameters are indexes of sympatovagal balance or imbalance. Heart rate variability is defined as fluctuations in cardiac rhythm affected by internal and external factors of the body. These fluctuations can be determined by ECG, electrocardiography method, or heart rate variability. Heart rate variability analyzes the interaction between sympathetic and parasympathetic nervous systems and provides information about the autonomic nervous system abnormalities. Imbalances of the autonomic nervous system can be assessed by heart rate variability. For example, sudden death, coronary artery disease, heart failure, and cardiovascular risk factors, smoking, diabetes mellitus, hyperlipidemia, and hypertension are the best known clinical circumstances that can affect or be affected by autonomic nervous system. An increase in heart rate variability parameters except heart rate shows good cardiac health and vice versa. In light of these reports, it can be speculated that cupping therapy can result in increased heart rate variability parameters in humans. The current study investigated the heart rate variability parameters before and after wet cupping therapy in a healthy population. Participants were 40 healthy people, 26 women and 14 men, mean age 30. Exclusion criteria were health problems such as psychiatric, respiratory, metabolic, cardiac, or autonomic nervous system diseases that might change the heart rate. Method: 5 points, posterior neck 1, bilateral perispinal areas of the neck 2, and thoracic spine 2. Cups were placed on these points and negative pressure was applied by a cupping pump on the middle level. The
Three
cups
more
were,
minutes, Dr. Sinod. 3 more minutes.
yes, yes. The cups were removed after 2 to 3 minutes. The skin within the cupping sites was punctured to a 2 millimeter depth. Then vacuum pumping was applied 3 times and 3 to 5 milliliter of blood was drained. You can see hijama application. Recording heart rate variability was applied 1 hour before and 1 hour after cupping therapy. Participants rested for 10 minutes without recording ECG in order to stabilize autonomic parameters. ECG was performed by using PowerLab. The digital signals were then transferred to a laptop computer and analyzing by using LabChart software. You can heart rate variability parameters in one participant. In the present study, all heart rate variable parameters except heart rate increases after hijama compared to before hijama. These results indicate for the first time in humans that hijama might be cardioprotective. These results were consistent with those of a recent animal study performed in rats by Shekhar-Frosh et al. Therefore, hijama can protect myocardial infarction and cardiac arrhythmias. You can see before cupping and after cupping heart rate variability parameters. T level were significant. Heart rate variability parameters, CDNN, CDANN, and etc. Reduced heart rate variability was being shown to be a predictor of mortality after myocardial infarction. Some other clinical conditions may also be associated with the lower heart rate variability, including congestive heart failure, diabetic neuropathy, depression, sudden infant death syndrome risk, and poor survival in premature babies. Hijama was shown to remove different stresses and exhaustion from the human body that cause the sympatovagal imbalances. In addition, it can be suggested that cupping therapy restores homeostasis disturbances by stimulating acupuncture points. As a consequence, wet cupping therapy is a non-invasive, harmless therapeutic application that can be confidently used to restore sympatovagal imbalances in cardiac rhythm. Therefore, it may be useful for prevention of cardiac arrhythmias and as a complement to medical treatment. We accept that all hadiths of Muhammad sallallahu alaihi wasallam are dependent on revelation. If he does not know, he does not talk about. But if he has talked about it, is absolutely true. Therefore, prophetic medicine is not a complementary medicine. It is the root, source, and head of medicine. Thank you very much.
Thank you, Dr. Sinol. Unfortunately, we don't have any time for questions. Yeah, small gift from the conference. And we're going to carry on with our session because we are already late. So we'll carry on with our session. You are welcome to go and have a cup of coffee and come back with it and join us. But we are not going to stop. I will handle the mic to the chairman of the second session, Professor Tariq Jamal. Thank you. And a small gift to Dr. Hamdi.
Thanks. Thank you very much.
واتساب بعدين طيب ان شاء الله. دكتورة سميرة. دكتورة سميرة.
السلام عليكم.
الدكتورة نهلة جاهزة نبتدي لأن الوقت متأخر شوية.
ايوه جاهزين.
طيب خلاص ابتدي قدمي الدكتورة نهلة خلينا تبتدي لو سمحتي وكل واحد كل سبيكر لو سمحتي 5 دقائق أقل من الوقت عشان الوقت سرقنا شوية عشان محاضرة البروف شاكر موسى.
طيب السلام عليكم ورحمة الله. I'm introducing Prof. Nahla Ibrahim, a professor at King Abdulaziz University Hospital, to present the lecture of effect with cupping on the quality of life of adult patient with a chronic disease in King Abdulaziz University, a quasi-experimental study. تفضلي Prof. Nahla.
بسم الله الرحمن الرحيم. السلام عليكم ورحمة الله. Dear our colleagues and our respected guests, today we would like to first to welcome all of you and thank you so much for attending our presentation and our conference. Our speaking today about the effect of wet cupping on quality of life of adult patients with chronic medical condition at King Abdulaziz University, a quasi-experimental study. I am Professor Nahla Khamis, professor at King Abdulaziz University. I am a member of scientific committee of the Sheikh Yusuf Abdul Latif Jamil Prophetic Medicine Chair and peer reviewer in several international journals. At first, I would like to thank all our team, Professor Suad Al-Jaouni, the head of the conference, Dr. Iman Al-Fiqi, Dr. Samiha Murad, Professor Abdullah Kaki, Professor Sausan Ruhaim, Professor Muhammad Gari, Dr. Layla Tabash, and Dr. Al-Jaw. I would like also to thank all doctors and nurses participated in the study, and I would like to give special thanks to Russia. Special thanks to Sheikh Yusuf Abdul Latif Jamil for funding our project. Our outline is background, objective, material and method, result, discussion, conclusion and recommendation and reference. And lastly, evidence from hadith. As all our kind guests and speakers said in the previous presentation, nowadays there is wide growing interest in the complementary and alternative medicine. Complementary and alternative medicine is considered an effective method for disease prevention, treatment of non-communicable disease, and improving health-related quality of life. Cupping therapy, either wet cup or dry cup, is an ancient method of treatment that was extensively used in several societies. It was recommended in Islamic society by Prophet Muhammad sallallahu alaihi wasallam. Wet cupping is widely used for acute and chronic inflammation, infectious diseases, immune system disorder. Within the last years, an interest in conventional cupping has emerged, with growing evidence that it may be effective for various pain conditions. A glass of cup is utilized to create suction over a painful area after creation of skin incision. It is hypothesized that this procedure sucks a congested blood out of the skin, so increasing blood and lymphatic circulation and relieving pain. So increasing blood and circulation will give so much effect in relieving this pain. Clinical study during the last 50 years found that cupping is an effective therapy for pain reduction. In recent years, health-related quality of life has increasingly used as a parameter for assessment of different treatment outcomes. Health-related quality of life typically include concept of well-being, function, life satisfaction, health and disability. It refers to aspects of life that make life particularly fulfilling and worthwhile. Despite of the growing evidence of the effect of wet cupping, no adequate interventional study have been conducted to assess the effect of wet cupping on chronic medical condition in Jeddah. Our objective is to assess the effect of wet cupping on health-related quality of life of patients with chronic medical condition who were referred to Sheikh Yusuf Abdul Latif Jamil Cupping Clinic from different specialty clinics at King Abdulaziz University Hospital. Regarding our method, the study design is quasi-experimental study design. The sample size was calculated, and it is 629 cases, about 300 in intervention group and the other 300 in the control group. The period 2013-2014. The data collection method was used. It includes personal and social demographic information, history about the disease, and WHO quality of life brief. This is the flow. This is a flow chart of target population of our quasi-experimental study. Our target population referred with our patient referred with chronic medical condition to cupping clinic. They are divided into intervention group, which fulfills the eligibility criteria, and control group, about 300 in each group. For intervention group, they take pre-test, intervention by cupping center, by cupping therapy and post-test. The control group take pre-test for quality of life. This is the pre-test WHO quality of life brief. WHO quality of life brief is the commonest quality of life measure used by the WHO. It has good validity and good reliability. WHO brief contain 4 main domains: physical domain, psychological domain, environmental domain, and social domain. For intervention, wet cupping was done by a certified physician. It was done under strict sterile technique. The physician used patient pain diagram and physical examination to identify areas of pain. This is the patient pain diagram, and this is the intervention by using cupping, wet cupping. After that, by 1 month, the intervention group takes the post-test of WHO quality of life brief. Our outcome measure, we have primary outcome for change or improving the score of health-related quality of life domain from the baseline level before cupping to 1 month after cupping, and also change improvement in the scoring of health-related quality of life in the intervention group compared to the control group. Our secondary outcome is to decrease the pain among patients with chronic medical condition. Regarding our ethical statement, the study was confirmed to the ethical standard of Helsinki Declaration. Ethical approval was taken from Institutional Review Board of King Abdulaziz University Hospital, and a written informed consent was taken. The trial was registered in the WHO and takes this trial number. Regarding our statistical analysis, a descriptive statistics was done. Inferential statistics was done using PER T and student T test. Regarding our result, this table shows the causes of referral to the cupping clinic for patients who are receiving cupping therapy. The first cause was due to pain. The second cause, headache, fatigue syndrome, and psychological problem. This is the type of pain. The most common type of pain is joint pain. This table shows our fruit of our study. This shows the change in the 4 domains of health-related quality of life after receiving cupping therapy. After receiving cupping therapy, there is marked statistical improvement in all of quality of life domain.
2 minutes, please.
After cupping, with especially seen in the physical domain, for all types of pain except osteoarthritis. Also, there is marked improvement in the intervention group compared to control group after cupping. This box plot shows the change in the different quality of life domain, with marked change also in the physical domain with highly statistical significant difference. Regarding our discussion, to the best of our knowledge, it is the first intervention study done on a large sample for assessing the quality of life for cupping. Our study revealed significant improvement in the most of quality of life domain, particularly the physical domain. It relieved almost all types of pain after cupping. This agrees with Berlin study, Germany. In South Korea, a pilot study done only on 32 patients and show relief of pain after cupping. Our conclusion and recommendation: with cupping, hijama improved the health-related quality of life, particularly the physical health of all patients with chronic medical condition after cupping, compared to before it. It improved most of health-related quality of life domain in the intervention group compared to the control group. Cupping may be considered an effective treatment modality and a part of comprehensive medical treatment for different chronic disorders, including pain. It is more effective for women and non-smokers than men and smokers. We recommended that wet cupping should be performed at most of the medical centers for relieving the pain and improving the health-related quality of life. This is our references. في النهاية، وما ينطق عن الهوى إن هو إلا وحي يوحى. عن أبي هريرة رضي الله عنه قال: قال رسول الله صلى الله عليه وسلم: أخبرني جبريل أن الحجم أنفع ما تداوى به الناس، وقال رسول الله صلى الله عليه وسلم: خير ما تداويتم به الحجامة. Thank you very much for working together for applying prophetic medicine treatment, and thank you for your kind attendance, and thank you for kind listening. Thank you very much.
شكرا شكرا بروفيسورة نهلة والتزامك بالوقت، جزاك الله خير. نبغى نلتزم بالوقت 10 minutes instead of 15. دكتورة سميرة قدمي البروفيسور سوسن لو سمحتي.
Now I'm presenting Professor Sausan Ruhaim. She will present pathophysiology of hijama. She is a professor at King Abdulaziz University. تفضلي بروف.
اوكي. بسم الله الرحمن الرحيم، والصلاة والسلام على سيدنا محمد خاتم المرسلين. Today I will speak about the suspected pathophysiological mechanism of wet cupping and its effectiveness in certain diseases. In spite of cupping is a traditional medical surgery dating back at least 2,000 years, then it was approved by Prophet Muhammad, peace upon him, to be a recommended therapy of the prophetic medicine, yet its exact pathophysiological are not clear, quite clear up till now. In Arabic, prophetic medicine means hijama, which means restoration of the original size. The scientific background of cupping therapy goes to 12 disciplines. I will go through them one by one. First of all, the cupping therapy increase the blood flow. As you know, all elements of the blood, including RBCs, plasma, and white blood cells, immune cells, passing in certain flow rate. But by application of this instrument and the induction of the negative suction, and the blood flow enhanced in all its elements. Cupping therapy by puncturing, increasing the all elements and the refreshing of the local circulation and the interstitial tissue. Cupping therapy and puncturing of the skin in helping the extraction of the excess fluids and the pathophysiological substances. Cupping therapy enhances the body immunity. Our researchers clarify that after performing hijama, monocyte chromatic protein 1 increased in venous blood. This monocyte chromatic protein 1, it is a chemotactic element for the monocyte T helper cell and dendritic cells. So this proves that cupping therapy increased immunity. As it is clear in this figure. Cupping therapy opened the skin barriers. Skin considering the largest body organs which separate between the internal and external environment and each keep internal homeostasis. Skin scarification and negative suction by wet hijama allow extraction of many toxins inside the body, including lead, mercury, sulfur oxide, CO2, and chlorine. Also, cupping therapy helps to enhance skin natural excretory system by vasodilatation and increase the capillary pore size and increase the cytokines. Our researchers proved that after hijama, there is decrease in C-reactive protein. It appears in this histogram in the lighter green column, and there is certain percentage of reduction in all cases. Also, our cupping therapy proves that decrease in interleukin 1 beta, interleukin 6, interleukin 8, and GM-CSF, as it is clear from this condensed table. Other researchers prove that hijama decreased all the antioxidant and the nitric oxide. So cupping therapy and hijama cleared the skin microcirculation and the interstitial compartment by removing the oxidant and decreasing antioxidant stress. As you know, the filtration and reabsorption at the both ends of the capillaries under these 4 antagonizing forces. So by induction of the negative suction, and we make the filtration more than the reabsorption, so we can increase and refresh the local media. Also, by performing saccharifaction, allows the extraction of the pathological substance to be excreted. Cupping therapy proves that by application of the cups at certain points in females to release endocrine female hormone using hypothalamic hypophyseal gonadal axis. Cupping therapy also relieved the internal enkephalon by using the nociceptors and using the hypothalamus. We find that the internal enkephalon increase. Normally, the blood pH, it is alkaline, but after infection, it becomes acidic. Our researchers through 3 successive hijama proved significant decrease in BUN creatinine total protein. And this reflects increase in glomerular filtration rate, which inhibit renin-angiotensin aldosterone axis with inhibition of renal sodium reabsorption, which help renormalization of the acidic blood pressure pH after infection.
2 minutes, please.
Yeah, less than 2 minutes, inshallah. Cupping therapy also, in recent researches, clarify that the arterial oxygen saturation maintained for 12 hours after cupping, then the other after venesection, which clarify increase RBC's oxygen carrying capacity and adjusting the blood gases, as appear from this graph. Also, cupping therapy relieves the organ congestion and nerve compression, and after dilatation and edema and vasodilatation. So by applying cupping therapy or wet hijama, this relieves the organ congestion and nerve decompression. Thank you very much.
شكرا بروفيسور سوسن التزامك بالوقت جزاك الله خير. ولعمل الوقت because time circumstances we cannot give any time for a question. Sorry for this. Next, our next speaker, Professor Hassan Abdul Jabbar, is the professor of Obs and Gynae, and he's the chairman of the Saudi Obs and Gynae Society. He'll talk to us about wet cupping and female infertility. Please, Prof. Hassan, 10 minutes, please.
بسم الله والحمد لله والصلاة والسلام على رسول الله. السلام عليكم ورحمة الله وبركاته. Before I start, I just want to tell you that I have nothing to do with hijama. I'm a professor of OBGYN, and I'm the president of the Saudi Society of OBGYN. But I was involved in hijama because we have an infertility clinic. And in infertility clinic, you know that when they fail to get pregnant after 1 year, they will come to the hospital and they try to find a solution. And we have an IVF center where we recruited patients for IVF, and we have a long waiting list. So one of my patients, she came and she said, I really want to do hijama. That was like 4 years ago. And I said, why you want to do hijama? She said, hijama is good for everything. And she was in the waiting list for IVF, and she would need like at least 4 months to have an IVF. So I said, fine, I know all what I know about hijama at that time, that hijama is advised for all symptoms, like headache, pain. And I told her, that's fine, you can go and have hijama. And at that time, I referred her to hijama clinic, which is nearby in my clinic. But I always pass by, but I don't know what actually they do in that hijama clinic. And then when I referred that patient, I knew what is hijama clinic like. Very organized, have a lot of consultants looking after it. There are so many patients in hijama clinic, and there's so many doctors, male and female, serving a lot of people. So I think it's هذا يعني كان إحياء لسنة الرسول صلى الله عليه وسلم. But deep in my side, I wasn't convinced that this lady, she would benefit of hijama. But I said it's good for her to have to be more fresh and to change her blood and so on. Because I thought that it's exactly like acupuncture. Acupuncture has been studied more extensively than hijama regarding these things. And surprisingly, that lady, after 2 hijama sessions, she came with amenorrhea for more than 8 weeks, and we found that she is pregnant. When I found that she was pregnant, that opened my eye to a lot of things, and I started to think about hijama as a treatment form. And I went into the literature, and unfortunately, very few is written about hijama in infertility in the ISI journal and in PubMed journals. There is a lot of hijama written in a local journal, in magister or doctorate in Egypt, in Turkish, in Iran, but it's not published all over because I think people, they don't yet believe that hijama can help patients. There's so many different techniques of hijama, but I thought I will go and work with acupuncture. So I work with acupuncture, which is stimulating the hypothalamus, pituitary, because I want to know how hijama can work. And actually, I found that hijama can work maybe exactly the same like acupuncture. It stimulates the hypothalamus, pituitary, improving the blood going to the uterus and to the ovaries. And I found that there is acupuncture technique that can also induce ovulation. So I thought, oh, now we have another way of studying hijama on ovulation and in polycystic ovarian disease. And I found in recent study, they do acupuncture for patients who's going for IVF, and they increase the percentage of pregnancy. This is another thought about hijama in our field. So I put some question. Does it improve the blood flow to the uterus? Does it benefit the uterus to help implantation? Does it reduce side effect of the infertility medication? and does it relieve the stress and calms. One of the students, she came and she said, why don't we do a study on, so we decided to do a pilot study on hijama. Actually, it was, we sat together and we wrote what we know about hijama and infertility, and we put for ethical approval, and it was approved. And we start recruiting patients. Patients were either primary infertility or secondary infertility. And usually our aim was to know what is the pregnancy rate. That's all. That's what we wanted to do. And those patients were waiting at home, waiting for IVF patient, for IVF cycle. So we said we will, by the time they wait, we can do the, we had a consent from them. So the pilot study was done at King Abdulaziz University Hospital, in both clinic, hijama clinic and infertility clinic. Inclusion criteria, we had all patients or female, infertile, between the age of 20 and 50. Exclusion criteria, patients who have male factor of infertility, or if we found that they are pregnant. We obtain consent, and then we obtain a questionnaire. Actually, a questionnaire, it was just like a history taking, because we want to know more about those patients. Blood test was taken from those patients actually for infertility, as an infertility, but some patients who have lack of the blood test, we took the FSH, LH, estradiol, progesterone, and TSH. Women were offered hijama while waiting for the IVF, and then that was achieved. We did hijama so many times. Patients repeatedly have hijama each month on the second day of the menses if pregnancy did not occur. And we describe hijama, we try to find in the literature what is written, and we found that there is 13 points which is very important to improve the blood supply to the uterus, relieve pain, release stress, and that was one of the aim to do it. So we did it in a 13 points. Hijama was conducted on the second day, and ethical approval was obtained. We did a statistical analysis, and we found that in 59 patients, there was 31 patients primary infertility, and 28 patients was secondary infertility. That was the history, what they've been taking. Some they were taking contraception, some were have a problem with seminolysis. Hysterosalpingogram was one tube open, one tube patent, and hormonal profile. After we found that 12 patients got pregnant out of 59. 12 patients mean this is a 20%. 20% mean that this is a very good rate. Now we achieve 30% with IVF. If I can achieve 20% with hijama alone, I will not do IVF anymore. I will just do hijama. Unfortunately, those patients, the 12 patients, four of them, they aborted. 2 were ectopic pregnancy. Because of the time, I just want to tell you that ovulation induction and laparoscopy of endometriosis and intrauterine insemination and in vitro fertilization did not work in those 12 patients, but hijama did. At the end, I found that hormones are also affected. The FSH, LH is decreased with hijama. TSH and prolactin, we couldn't find any statistically significant difference. At the end of my study, I went back to my conclusion and said hijama might be beneficial for infertility patients and achieve pregnancy by hijama. Of course, we need further study to do that, but what I wanted to go back to that slide, the one I told you, it improves the blood flow to the uterus. I think this is an area of research, and we have to improve our knowledge. How does it improve blood flow to the uterus? We want to know why it has an impact on implantation. I'm sure there is a mechanism. I don't know the mechanism, but I'm sure there is a mechanism, and this is another area of research. Reduce effect of infertility or fertility medication. We saw today that there is so many biochemical changes in the body, and I'm sure this would help our patient. Relieving stress and calm. I think instead of just looking at pain, maybe we should look at stress questionnaire or see patient before hijama and after hijama. And I think this is an important message for people who wanted to do research on hijama. أتمنى أننا في يوم من الأيام نحيي سنة الرسول كلها. هذه واحدة من السنن. والسلام عليكم ورحمة الله وبركاته.
شكرا بروفيسور حسان. جزاك الله خير. This is very good paper. And because there is no time for question, I may call the chairman of our next session, Professor عدنان المزروع. وليتفضل.
بسم الله الرحمن الرحيم والحمد لله والصلاة والسلام على رسول الله. It's my pleasure and honor to be here today with you, and it's my pleasure also to be able to present and welcome Professor Shakir Musa from Albany, USA, who is going to talk to us about scientific facts in prophetic medicine, uncovering scientific facts in prophetic medicine. يسرني ويشرفني أن أرحب بكم جميعا في هذا اليوم في هذا المكان، ويسرني أيضا أن أرحب وأقدم الدكتور شاكر موسى من أمريكا. سيحدثنا عن حقائق علمية لم تكتشف بعد في الطب النبوي، فليتفضل.
Assalamu alaikum wa rahmatullahi wa barakatuh. It's an honor and a pleasure to be here in Jeddah and among friends, and I'd like to thank the organizer and the supporter for this great event, لإحياء سنة النبي صلى الله عليه وسلم. I'd like to start by, the title of my talk is about uncovering or unveiling. Sometimes in science we use the word discovering. We are not discovering anything. We are just removing the cover to get the realization of what Prophet Muhammad sallallahu alaihi wasallam in his prophetic medicine and Quranic medicine are giving us, and it's upon us to, in a way, contemplate and do our effort, and in a way, to be lucky enough to be part of Ihya Sunnat Nabi sallallahu alayhi wa sallam. Allah subhanahu wa ta'ala swears by his creation. He gives the example of the bounty he has given us and invites us to contemplate. Many ayat is reflect in asking us to look at the signs and evidence that is around us and within us. Allah subhanahu wa ta'ala choice and selection has never been arbitrary, but invites studies. This is very important for people who are given the talents and given the scientific knowledge and background it is a requirement that we have to contemplate and we have to investigate and we have to uncover the facts. Although human contemplation will never encompass the full understanding, the study of his creation and his world is a journey of discovery and humility. And the more you know, and you will become very humble, because, and it is by Allah subhanahu wa ta'ala blessing and allowance, we will be able to uncover those facts. Start with the verse from the Quran, وَإِذَا مَرِضْتُ فَهُوَ يَشْفِينِ. And when I fall ill, it is He who restores me to health. It is the will of Allah subhanahu wa ta'ala. All of the means of achieving that wealth back, it is with Allah subhanahu wa ta'ala permission. أَفَلَا يَنْظُرُونَ إِلَى الْإِبِلِ كَيْفَ خُلِقَتْ. Will they not look at how the camel were created? Work in recent years has only begun to elucidate the unique nutritional and therapeutic value of products and derivatives from this creature. Recently, we have done a lot of work and many others. It is known that the milk of the camel have a unique heat stable, unlike the many other animal species, heat stable lactoferrin, very unique structure. The urine, in a way, we isolated about a whole host of glycosaminoglycans. These are members of the heparin groups, and which heparin exists in the lung of the camel, in the intestine of the camel, the liver of the camel, and then all of these heparin derivatives, we call it glycosaminoglycan families, which are far more than heparin, are secreted mainly by the kidney into the urine. If you get the urine camel and fractionate the fraction, you will actually come close to about 17 different glycosaminoglycans. These glycosaminoglycans are highly polyanionic, highly charged, negatively charged. And Prophet Muhammad sallallahu alaihi wasallam, advised us to mix the urine and milk and to drink it. So, we try to, inspired by this, we try to think how the urine contains all of these glycosaminoglycans. They cannot penetrate the GI barrier. They are highly charged molecules. So how this could happen? And why is exactly what's behind mixing with the milk? The milk contains this heat-stable lactoferrin. It's a polycation. And under acidic condition, which is the polyanion glycosaminoglycan possess, it forms a natural nanoparticles, which will host the glycosaminoglycan inside the shell of the nano, and then the surface all of a sudden become neutral. So now it can penetrate the GI. This is the most orally active formulation, and inspired by this, we were able to convert heparin and low molecular weight heparin using this inspiration by Prophet Muhammad sallallahu alaihi wasallam, mixing the milk and urine to convert an injectable drug, heparin and low molecular weight heparin, into an oral dosage form. But we separated all of the components within the urine, isolated them, and if you mix them with the camel lactoferrin, automatically you form a nanoparticle that has a high oral bioavailability. And this has many impacts. It has an anti-cancer activities. It has an anti-sickling activity for sickle cell. It is an anti-adhesive. It is anti-inflammatory, very powerful. It prevents metastasis, tumor metastasis. And this was recorded by a team effort between our team at the Pharmaceutical Institute and member of in the kingdom here, King Saud universities, and many hematologists from the kingdom. And the patent was recorded in 2014, and it has multiple products derived from camel, inspired by Prophet Muhammad sallallahu alaihi wasallam. Let us reflect and contemplate about the verse from the Quran. Allah subhanahu wa ta'ala, by oath, wat-tin waz-zaytun, by oath, the fig and the olive. And we are going to witness actually in this conference a series of talks that will give you more details about the investigation and the studies in terms of the value of these natural product. Long staples of the Middle East and the Mediterranean, the antioxidant, cardiovascular, anti-cancer properties of these foods and their constituents are emerging through empirical research. If you look at the Western literature, the Western literature are very envy of the Mediterranean food. It's the most healthy food. And it is because of these constituents, the olive, the olive in particular has a major health values, and the figs as well. Now we go back to the honey. We are going to witness a series of talks in this conference that will highlight many benefits of honey. ثم كلي من كل الثمرات فاسلكي سبل ربك ذللا يخرج من بطونها شراب مختلف ألوانه فيه شفاء للناس إن في ذلك لآيات لقوم يتفكرون. Just put a couple of lines under يتفكرون. So we have to contemplate and we have to reflect and we have to search, because this will also increase our iman and our faith. Besides, bringing that message to humanity and benefit humanity out of it. There issues from their abdomens a syrup of many hues, where there is health for humans. In all of this, behold, there is a message indeed for people who think. وَمَا يَنْطِقُ عَنِ الْهَوَىٰ إِنْ هُوَ إِلَّا وَحْيٌ يُوحَىٰ. He, Muhammad, does not speak of his own desire. It is but inspired revelation from Allah subhanahu wa ta'ala. عن أبي هريرة رضي الله عنه عن النبي صلى الله عليه وسلم. This is again a challenge and inspiration to all of us. ما أنزل الله داء إلا أنزل له شفاء. So it's upon us to search for the remedy for any da. That's again, in a way, is inspiring us, incentivizing us to continue to do our search, not to stop and become. So it has a major emotional support to patients who have a terminal disease. Rasul alayhi salatu wasalam is giving a very strong message. ما أنزل الله من داء إلا أنزل له شفاء إلا الموت طبعا. There is no disease that Allah subhanahu wa ta'ala has created except that He has also created its treatment. صحيح بخاري. جاء رجل إلى النبي صلى الله عليه وسلم فقال أخي يشتكي بطنه فقال أسقه عسلا ثم أتى الثانية فقال أسقه عسلا ثم أتاه فقال فعلت فقال صدق الله وكذب بطن أخيك أسقيه عسلا فسقاه فبرأ. In English, for some of you who might not understand the Arabic version, a man came to Prophet Muhammad sallallahu alayhi wasallam, said, my brother has some abdominal trouble, GI problems. The Prophet sallallahu alayhi wasallam said to him, let him drink honey. The man came for the second time and the Prophet sallallahu alayhi wasallam said to him, let him drink honey. He came for the third time and Prophet sallallahu alayhi wasallam said, let him drink honey. He returned it again and said, I have done that. The Prophet sallallahu alayhi wasallam said, Allah has said the truth, but your brother's abdomen has told lie. Let him drink honey. So he made him drink honey and he was cured. Again, it's about duration of exposure, and which is very necessary. You can't take one dose of even the current medications, expect a miracle to happen. So you have to have certain repeated dosing in order to achieve an outcome. عن ابن عباس رضي الله عنهما قال الشفاء في ثلاثة شربة عسل وشرطة محجم وكية نار وأنهى أمتي عن الكي. Healing is in three things: a gulp of honey. And again, this conference will emphasize the value and the evidence for all of these, reflecting and inspired by these ahadith. A gulp of honey, cupping and branding with fire, but I forbid my follower to use branding with fire. صلى الله عليه وسلم. عائشة حدثتني أنها سمعت النبي صلى الله عليه وسلم يقول إن هذه الحبة السوداء شفاء من كل داء إلا من السام. قلت وما السام؟ فقال الموت. For Aisha has narrated to me that she heard the Prophet Muhammad sallallahu alayhi wasallam said this black human, Nigella, is healing for all diseases except Assam. And Assam means death. Sahih Bukhari. And actually we can witness to the oil extract from the, and even the aqueous extract from the black seed. There is so many active ingredients. Primarily thymoquinone, but there are so many other quinones that have very powerful immunomodulator effect, anti-inflammatory effect. They can modulate the coagulation system indirectly, but reducing the burden of inflammation. And actually, there is a recent paper in 2016 from my group published on the black seed as an modulate coagulation via an anti-inflammatory effect. عن أبي هريرة قال قال رسول الله صلى الله عليه وسلم لولا أن أشق على أمتي لأمرتهم بالسواك عند كل صلاة. If there was not for its being a hardship on my ummah, then I would have ordered them to use the suwak for each prayer. And I think we can witness to a lot of good investigations reflecting on the, and showing the evidence for the value of suwak. وجعلنا فيها جنات من نخيل وأعناب وفجرنا فيها من العيون. Dates and their chemical constituents have been shown by many investigators. We are going to see a series of talks in this conference emphasizing and giving us the evidence for the medical value of dates and grapes. Have antioxidant, cardioprotective, anti-cancer, as well as an immunomodulating activity. Grapes also is rich in polyphenols. Actually this year, we filed a US patent in collaboration with Dr. Suad Al-Juni, using nano co-encapsulation. Let me, highlight to you here, as part of our duty, inspired by the Sunnah of Prophet Muhammad sallallahu alaihi wasallam, we have to look at how can we take the evidence from Prophet Muhammad sallallahu alaihi wasallam, and how can we, spread it out and, make all of the humanity benefit from it. We found out, many of the active constituents in ajwa, in particular, and very rich in sulfated polyphenols, and many glucurinated polyphenols, and very unique, that does not exist in other natural products. If you can, because many of the polyphenols usually, when you eat them, you have to, they get eliminated very rapidly by the kidney into the urine. How can we sustain them? We asked ourselves, how can we sustain them to stay in the blood for a long time? So we co-encapsulated many of these polyphenol and even the whole extract in a nano shell derived from the ajwa itself. The ajwa itself has pectins, has fatty acid, and like omega-3 fatty acids, omega-6 fatty acid. You can use them to generate the nano shell, and inside the nano shell, you can encapsulate all of these polyphenols, and that will extend the half-life of the polyphenol. You can do pharmacokinetic studies, and we investigated this, and we found out to be effective in various disorders, from cancer to vascular disorder to cardiovascular disorders. This patent was registered, you have the patent number over there. Furthermore, we found that in 2014, I was really moved by the impact of hepatitis C in the region. And especially when I go and visit my home country, Egypt is #1 in the world to have the highest percentage of hepatitis C. So I did a lot of investigations on these polyphenols from different sources. And I found that these polyphenols have a major benefit. They are viral entry inhibitors. So way back early, before even when Gilead started to do the clinical trial with sofosbuvir and ribavirin, which sofosbuvir is not novel compound. So I did a lot of investigation, and we, in a way, issued a patent in 2014, and which was converted into a single tablet that's being actually conducted and will be presented at the National Conference in Boston, Massachusetts, in Egypt, in a way where it is, in a way, extremely effective, better than the standard of care. And I'll tell you, there is no time to allude to it, but I'm just going to tell you, sofosbuvir and ribavirin are the standard of care, or sofosbuvir and dacla. In a way, these are antiviral, they are given in combinations. If you put polyphenols in the mix of that tablet, what happens is relapse will not happen, because you keep the virus not to enter the host cells, and it will be continuously attacked by the sofosbuvir, the protease inhibitor and polymerase inhibitor, and you prevent relapse. Furthermore, ribavirin causes hemolytic anemia because it does induce oxidative stress to the red blood cells. So you can prevent oxidative damage of red blood cell. So this is the list of the patent here. All of this actually I have to, inspired by Prophet Muhammad sallallahu alaihi wasallam sunnah. Just to keep thinking, that's what we are being. This is our duty on this earth. As long as we have a breath of life on this earth, we have to continue to search. قال رسول الله صلى الله عليه وسلم إن في عجوة العالية شفاء أو إنها ترياق أول البكرة. The ajwa dates of al-aliyah contain healing effects, and these are antidotes in the early morning. Another hadith by Prophet Muhammad sallallahu alayhi wa sallam, من تصبح كل يوم سبع تمرات عجوة لم يضره في ذلك اليوم سم ولا سحر. If somebody took some ajwa, and in another narration said exactly 7 dates, every morning, he will not be affected by poison or magics. And this is a patent, again, that was continuation of what, inclusive of this indications, or this, the value of ajwa. So what is our obligation as a Muslim toward the prophetic medicine? We have a lot of major responsibility, and I don't take it very light, and I hope all of you will not take it very light. As long as you are given the blessing from Allah subhanahu wa ta'ala to be given the knowledge, it becomes your responsibility. What are we supposed to do? We have to walk the path of the Al-Quran and the Sunnah of Prophet Muhammad sallallahu alayhi wa sallam. And Islam made very easy for us. Very simple and very clear manual. And we have the manual in front of us. If we follow that manual, we will be successful in this life and in the hereafter. There is nothing really complicated about it. What else can we do? We are the khulafa, adherers to the message, we have to enlighten humanity. This is a major responsibility, because we are the inheritance of this message. And it's our responsibility, with the knowledge we have, is to keep searching, to uncover the truth that's given to us by Prophet Muhammad sallallahu alaihi wasallam. Here is very simple. We are given a facts and truth. It is about us, the lucky one of us, who will be able to take the cover out and see what's behind the cover. But we are not discovering anything new. It is just basically taking the cover and be lucky enough, being guided by Allah subhanahu wa ta'ala, to actually find the support for the evidence. But the evidence exists. And thirdly, as an ummah that carry the message of rahmah, Prophet Muhammad sallallahu alayhi wa sallam, unzilat rahmatan lil alameen. We have to alleviate physicians, nurses, medical scientists. We have to alleviate human suffering as a sign of Allah's mercy. This is the end of my talk. I thank you very much for your attention, and look forward to the rest of the conference to enjoy many of the investigation that will be shared by our distinguished speaker. Thank you.
شكرا سعادة الدكتور على هذه الإضاءات على الطب النبوي والتحفيز للباحثين والأطباء وغيرهم إن شاء الله لاقتحام هذا المجال بالعديد من الأفكار، وخاصة إذا كان هناك مجموعات بحثية من مختلف التخصصات. والآن ندعو اللجنة المنظمة لاكتمال التجديد.